Yeah. Hey everybody, it's Kevin Paris again. Wanted to talk to you today and this week about low back pain and sciatica. I'm passionate about this because about 65% of my patients over the last 17 years have back pain and sciatica. And I'm getting pretty good at it over the years. So when I first started, I wasn't as good. I fixed about half. I had pain myself, I fixed myself, and since then, about 90% of people get relief with treatment from me with low back pain and sciatica. So I've really taken a lot of continuing ed classes and learning about this. So I want to talk today about the 3 common causes of low back pain and sciatica. So there's different reasons that you can have pain, different reasons you can have pain down the leg, low back pain. Number 1 is a disc herniation. Everybody says I threw my back out, or I hurt my back doing something. They don't know if it's a muscle strain, if it's disc, if it's something else. So disc herniation is the first thing I'm going to talk about. Usually that affects people 35 and younger. So if you're 35 and under that, it could be a disc problem. You're going to have pain down the leg. It's going to travel in a thin line down probably to the knee or below the knee. At the knee, that sciatic nerve branches off into 2, comes around the front, and then goes down the back of the leg as well. 80% are asymptomatic. What does that mean? It means that if I take 100 people out on the street and they have no pain, and I give them an MRI, 80% of those, 80 people out of 100, are going to have some kind of pathology on an MRI. But they're asymptomatic. They have no pain. So I don't get too hung up on an MRI unless you've had an MRI when you had no pain. Now you have pain, and then you get an MRI. But nobody's going to do an MRI if you have no pain. So I posted an article one time, don't get hung up on your MRI, or don't be your MRI. Same scenario. But I go by your symptoms and not necessarily the MRI results. And I asked the question before in a workshop I do free workshops on low back pain and sciatica. Can my disc herniation heal? And yes, it can. So if you have a disc herniation, it can heal. They've done an MRI on somebody with a disc herniation. They've undergone treatment, physical therapy treatment, and they did another MRI post-treatment, and it shows that it can heal. The second problem with the low back is, and disc herniation. What are some signs and symptoms? So if you have a disc herniation, you're going to have pain, pain with sitting, pain with having a bowel movement or using the restroom, pain with coughing, sneezing. It's going to shoot stuff down your leg. You're typically going to feel better with walking or standing in extension. Women typically, if they have heels on, they feel better because they put their low back in extension, so they typically feel better. So disc herniation, you feel better with walking or standing, worse with sitting. Brings us to arthritis, degenerative disc disease, and stenosis. That is usually 50 years and up. What are these people, what are the symptoms they have? So if you have stenosis, or you have degenerative disc disease, or you have arthritis, I lump them all together because they're treated kind of the same way. Usually you feel better with sitting. So if you're over 50 and you go to the grocery store and you're having to hang on to that buggy because your back hurts, you can't walk that far, you're worse with standing, you're worse with walking. You could sit all day long. You may be in this category. I have a lot of people that are over 50 that think they have a disc herniation when in reality they have stenosis or degenerative disc disease. The third one, SI joint, the sacroiliac joint dysfunction. Who does that affect? Well, anybody between the age of 15 and 90. So it can affect anybody. Usually these people are going to have trouble going up and down stairs. They typically have trouble rolling over in bed. They have trouble getting in and out of the car. Their pain is right here. They'll tell you, I have pain in this one spot. It's right there. This one's a little bit tricky because you can't detect it on an MRI or an X-ray. So if a lot of people are getting treated for stenosis or arthritis and they're going through therapy and they're not getting better, it's probably SI joint dysfunction. So that gets missed a lot. And I know early in my career, I missed this a lot. and looking back in retrospect, I should have been treating this. So I narrowed it down. Over 17 years, I narrowed it down into 3 categories. Here's what they are. Here's who they affect. If you want more information, I have a book that I wrote. It's called Back in Motion, and you can pick it up at my clinic. I'm located right beside Planet Fitness. I'll give you that for free. If you just walk in, ask me for the free book, I'll give it to you. So tomorrow, what are we talking about tomorrow, Leah?
The things you can do and the biggest mistake people make when dealing with pain.
So tomorrow, the 3 things that you can do when you have back pain and sciatica, and the number 1 mistake people make in dealing with back pain and sciatica. Stay tuned tomorrow. I'll be giving that seminar tomorrow. It's about a 2 to 5 minute little presentation. If you have any questions, find us on Facebook or call 724-416-7172. Stop in for your free book. I'll see you tomorrow.